Gastroesophageal reflux occurs when stomach contents return back to the esophagus. This happens when the valve between the stomach and the esophagus, called the lower esophageal sphincter, does not work properly. Reflux, commonly called heartburn, is often associated with a hiatal hernia. Other causes related to reflux are obesity, alcohol, and smoking. The most common symptoms of gastroesophageal reflux are heartburn, difficulty swallowing food or liquid, and regurgitation. Heartburn is a burning sensation that is felt behind the breastbone. It is caused by gastric contents that irritate the normal lining of the esophagus. Regurgitation is the sensation of food or fluid moving backwards in your throat. Other symptoms that may also be associated with GERD include chest pain not due to heart or lung disease, cough, increased mucus production, and hoarse voice. There are several important tests that are required to evaluate a patient for GERD. Upper endoscopy, or an EGD, is an exam that uses a small flexible tube with a light and camera at its end to examine the esophagus, stomach, and duodenum. In order to avoid discomfort, the procedure is performed under sedation. Endoscopy allows the doctor to observe the lining of the esophagus and detect ulcers, inflammation, hernias, infections, scar tissue, and precancerous changes. A tissue biopsy can be performed using a forceps. This does not cause pain or discomfort. Additional tests include barium swallow, pH monitoring testing, and high-resolution esophageal manometry. These tests are important parts of the evaluation and allow for assessment of esophageal function, the acidity, and movement of liquids within the esophagus. Barium swallow is a 20-minute test done by a specialized radiologist. A cup of contrast is swallowed sometimes with marshmallows or a tablet to assess the structure and function of your upper digestive tract. pH monitoring is performed with a small pH sensor that is either attached on the esophageal wall for 48 hours or inserted into the esophagus through a thin probe for 24 hours that will record all the reflux episodes. There is minimal discomfort associated with this procedure. Esophageal manometry involves passing a thin catheter through your nose and into your esophagus and stomach. After the catheter is placed, you will be asked to swallow salt water 10 times. Following this, the catheter is removed. This study does not require sedating medication and lasts about 20 minutes and involves minimal discomfort. This test is important information that your team uses to determine how best to treat you. The symptoms of reflux can be improved by avoiding certain foods and liquids, such as coffee, citrus, soft drinks, chocolate, fatty or spicy foods. Certain lifestyle changes can help limit GERD symptoms. These changes include limiting alcohol, stopping tobacco use, avoiding lying down after eating, and elevating the head of your bed and keeping weight in a healthy range. If symptoms persist, there are a variety of medications that can help. These medications include antacids such as Tums, H2 blockers such as Zantac or Pepcid, and proton pump inhibitors such as omeprazole. Medications can effectively control symptoms but do not cure reflux disease. Proton pump inhibitors are some of the most commonly recommended medications. These medications work by blocking the final step of stomach acid production and are usually taken once or twice a day before meals. They must be taken daily to be effective. In those patients with well-documented reflux disease who cannot tolerate medications, do not want to take medications, or have symptoms despite maximal medication dosing, surgical treatment can be considered. In our highly specialized center, we have several options for the treatment of GERD. Surgical options include Nissen fundoplication, magnetic sphincter augmentation. For select patients, we offer endoscopic therapies. Not all patients with reflux benefit from the same treatment, so each patient is evaluated by our team of specialists to develop an individualized treatment plan.